October is National Breast Cancer Awareness Month, a month dedicated to increasing awareness about the importance of early detection of breast cancer. Each year, nearly 250,000 Americans are diagnosed with breast cancer. Most are women, some are men. Let's say hello to the Fresh Outlook think tank. I'm joined by Dominick Rodriguez. He is a cancer survivor and he works with SAM Fund. I am also joined by Hogan, a breast cancer survivor from Adelphia Breast Cancer Hotline. Nadia Murdock, a nationally recognized fitness coach and published author, and joining us live via Skype, Dr. Bart Rossi, a political psychologist and our friend here at EBRU. I am going to begin with talking to you, Anne. You're wearing your pink today. That's a symbol of Breast Cancer Awareness Month. Tell me about what your group does.
Well, I was diagnosed 13 years ago with breast cancer, and I called the hotline and do my research of what to do now. And what they did is they guided me through the steps of what to do. They sort of focused me, and they were there. There were groups to help me out as newly diagnosed, and it was a total support program. Everybody on the hotline is a survivor. So when I went through my treatment, I had bilateral mastectomy, I had chemotherapy, and then I decided I wanted to do what these women did for me. I wanted to give back, and for the past 12 years I've been volunteering on the hotline and as an outreach speaker. And what we do is we offer support. We're there. The hotline is available 24 hours a day, 7 days a week. And women call in from everything on where can I get a free mammogram to I was just diagnosed, and they just cry on the phone. Yeah. They don't know what to do.
You need to talk to somebody who's gone through that.
Absolutely.
In order to realize all the issues that are involved with it, how it attacks your psyche. Now, Dominick, you're a cancer survivor, and how long ago were you diagnosed, and what prompted you to go to the doctor?
I was diagnosed a few months after my 30th birthday, actually. This was in 2007. Okay. I had just returned from an extensive overseas trip, and I was exhausted, and I figured I caught a bug of some sort, and I was, lugging 50 pounds of luggage around with me.
Right.
So I went to the doctor thinking he'd give me some antibiotics and send me on my way. So I showed up at the emergency room, and a few hours later they said, we're keeping you here, and I stayed there for 5 days while they figured out that I had cancer.
Huh. And so you went through chemotherapy, radiation, that type of thing?
Yeah, I went through some chemotherapy and some immunotherapy, and then I did a stem cell transplant as well.
Okay. And so you have been cancer-free now for a number of years?
Right, about 5 years, coming up on 6.
And 5 years is that magic number. After 5 years, the chances of having a recurrence seem less and less.
Absolutely.
Okay. And Nadia, your role in all of this is people like myself who are baby boomers, who are getting older, who take our vitamins and go to the gym. We want to stay fit because we hope this will battle back against cancer.
Right.
Tell me about your mindset about fitness and battling cancer and preventing cancer.
Sure. Exercise has a profound effect on the disease. People going through it can have an increased positive outlook, less chance of depression because of the endorphins that's getting pumped in. A small community can be built. I've interviewed people that have been going through breast cancer, and they got together because they were fighting the disease together. They still love fitness. They wanted to maintain some stability in their normal life. And through that, they have like accountability partners, they have the support. There's just so many benefits of exercise that doctors are now saying, depending on the stage and depending on the treatment, that you should exercise, you should move, and it can really help uplift you.
Oh, absolutely. If you do get sick or something happens to you and you're used to exercising and being active,
right,
that really depresses you that you can no longer go to the gym every day like you did if you happen to be a little bit crazy like myself, or you look like you go to the gym. All you guys are fit. Dr. Rossi, talk to me a little bit about the mental challenges that people have when they are diagnosed with breast cancer or any other grievous illness.
Well, sure. There's a whole new field that's called psycho-oncology, and really the approach is to try to reduce stress, have a positive outlook, use some of the psychological techniques like changing your expectation level temporarily, and using some guided imagery to take a look at where you could be a week or a month or 2 months out, so you can think differently change your behavior, and deal with this very devastating illness. And what we're finding is that more and more people are dealing with this so effectively now because of the new treatments that are possible, but also because of the psychology and the mental health outlook that a lot of folks are taking to combat this disease.
It's amazing the strides we have made in battling cancer. When you heard the big C years ago, you thought you were dead. You battled back, Dominic, and now you work with an organization called SAM Fund. Tell me what that is all about.
Right. The SAM Fund, well, the SAM part of that name stands for Surviving and Moving Forward. And it's the moving forward part that is really the organization's focus. They work with young adult cancer survivors to provide direct financial assistance, online education and support, and advocacy for that particular demographic. And so the biggest part of their mission is they give cash grants every year. There's an application process, and it's a really important thing because young adulthood is this time of life that's full of transition and risk professionally. People are leaving school, going to their first job, trying to build up their career. They may be trying to start a family. They may be looking forward to buying a home. It's an exciting time, but it's full of risk. And then to add on top of that a catastrophic event like a cancer diagnosis, it can throw everything into a tailspin. So the SAM Fund does a great job. You can get financial support for them for things that are just basic everyday life necessities, things that will help you get back on your feet once treatment is over. Student loan assistance, medical bill assistance, help with transportation, getting to and from your doctor's appointments, gym memberships, therapy. They're pretty open-ended because they understand that when you have this kind of catastrophic event happen in your life, you just feel out of sorts, and any little support that you can get to feel normal again is huge.
Exactly, makes you feel like a person again. And not to muddy the waters, but you read so much nowadays about too much detection, that people are being treated for cancers that don't need to be treated. Get a mammogram, don't get a mammogram. Get an ultrasound, don't get an ultrasound. It's confusing. I mean, for us men who love women, who don't want to see them sick and don't want to see them get unnecessary medical procedures either.
Well, you know, we have a rule of thumb that if you have no family history, you really don't need to start mammograms until you're 35 to 40 years old. However, we're getting calls on the hotline from women that are 26 years old and 28 years old. There's a rise in young women getting breast cancer. And the thing with breast cancer, how it affects women as a person. It affects you, lose your breast, you lose your hair, you're unrecognizable. So it's devastating to a young woman in their 20s or 30s to be afflicted with this. And we're finding that more and more now. The program itself, the Adelphi Breast Cancer Hotline, we do advocate that you do monthly exams. You know you need to be an advocate of your body. If you feel something different, you need to go to a doctor and you demand that you get a mammogram, even if you're 27 years old. You need to be an advocate for yourself, because we find that if you stick with the guidelines and the insurance guidelines, doesn't always help. So, you know, women call us and they'll be young and they'll say, you know, I've had this lump and now all of a sudden feels like it's moved. Get to your doctor right away. And if your doctor doesn't want to do it, you go to another one until they give you a mammogram.
The distinction is there's what is good for the individual and what is good for the healthcare industry as a whole. So you have to do what's right for yourself. Nadia, tell me about battling and preventing cancer through nutrition. This seems to be a focus nowadays.
There's a lot of foods that people are consuming on a daily basis that they should be avoiding. So it's all the same thing like you were saying, and be aware, take control of your life, read the labels, know what you're putting in your body, and don't just assume because it's labeled healthy, it is, because 9 times out of 10, it's filled with preservatives, unhealthy things that is, you know, carcinogens, basically.
So a lot of the processed foods, processed meats, cold cuts can be deadly.
Have
They're
GMOs.
often blamed for the non-Hodgkin's lymphomas.
Exactly.
Or associated with whole grains and vegetables, very important.
Very important. Things like sugar feed tumors. So, you know, sugar is hidden in so many things. So it's so important to read labels. I encourage all my clients to do that, because again, you can't just assume what you pick up that says diet or low fat is actually good for you.
Okay, I'm just going to quickly
Sure.
go to Dr. Rossi. Dr. Rossi, all of the things we talked about, the fact that this disease strikes at your personhood, you feel, unfortunately, perhaps less of a woman when your breast is cut off. Tell me how people like yourself help people who are going through these challenges.
Well, I think first and foremost, we have to deal with stress. As you know, stress hurts all of us. Our cardiovascular system, we suffer from anxiety and depression. Certainly, when you go through a disease like this, you do not want to have undue stress complicating all of these factors. So what psychologists can do is help with positive thinking, use some cognitive behavioral approaches, as I mentioned before, think positively and change the way you think so that your behavior will change and you'll move forward and tackle this disease like you're seeing with some of the folks in studio today who have been so successful.
All right, Dr. Rossi, thank you so much. Nadia Murdock, fitness coach, nationally recognized. Thanks for your time. You folks will be back. We'll be talking to you more in just a little bit. When we come back, we're going to look at the folks who beat the odds and inspired others after this.